So you also talked a lot about collaboration with key opinion leaders and different stakeholder groups. So share with us a little bit about that journey, because I think that you had a very enlightening experience that helped you pivot and change your product, like you said, from ideation, from really what was going to be viable in the marketplace, and to some of the features and functionality of that. So let's talk about that.
Part of being a good startup founder is to be constantly looking for who your end users are going to be. So before even kind of any of the prototyping of our physical device began, Jason, Kevin, and I were in hospitals shadowing EVS staff, the people who clean the room, for days and days and days on end. And we watched them, we asked them their problems, we cleaned some rooms ourselves. And I think that gave us a really good understanding of what the actual pain points were for the end user. So at the end of the day, the most important thing about the product is that the actual person that's using it likes it and feels like they're doing a better job because of the product. And so it is really scary to talk to the end user, but I think what we learned is that put yourself out there. We email tons of people. We have connections from our university, but it was also a ton of cold emailing, bringing in professor connections, bringing in alumni connections, asking anyone, that we possibly can know, friends, family, do you have anyone in the healthcare space that is interested in infection prevention, or can you introduce us to a hospital? And once you get one foot in the door, it becomes so much easier. Once one hospital is working with you and they understand the value proposition of your product, getting other hospitals to be interested and buy in your product is so much easier. But I do think the most important thing is that you need, as a founder, to not only be engaging key opinion leaders and, great advisors, but also to be constantly engaging the actual people that will be using your product. So, because at the end of the day, all the EVS managers told us, it doesn't matter if they don't like the product, we won't buy it. And so, that came down to we had to make a product that people would actually use and people would actually like.